As we celebrate these discoveries, the global situation will indicate that COVID-19 can very easily overwhelm health systems if containment measures are not adhered to. We have seen images of desperate patients being aired on various media platforms, and surely we do not want this to happen to us. This is why we have repeatedly emphasized on measures to avoid overburdening our healthcare system. The containment measures that we have put in place are intended to flatten the curve and to be able to not overwhelm our health systems when our cases begin to peak. The virus has proven that it is very resilient. Indeed, the experience of other countries has proven that behavioral factors, in addition to other interventions, play a large part in slowing down the spread of infections. To deploy behavior as the weapon to defeat the virus requires consistency. Any sporadic adherence to the containment measures only creates a fertile ground for the virus to spread. Hence our repeated appeals to Kenyans in order to achieve this consistency of behavior and practice in the campaign against coronavirus. The requirement of regular hand washing, maintaining social distancing, proper wearing of masks, observing basic hygienic standards, and staying at home must now become part of our everyday lifestyle. I know there are many Kenyans who have strictly observed these measures and regulations. I want to thank them for their cooperation, which has contributed to the achievements we have registered thus far. But I'm also aware that there are a few Kenyans who have difficulties in observing these measures. I want to remind them of the importance of obeying these interventions. It is true that measures disrupt our usual routine. However, a time comes when an individual must sacrifice his or her interest for the greater good of the majority. This is the time when every member of the society must put their personal interests aside and focus on the interest of the country. Fellow Kenyans, since yesterday, we have tested 1,056 samples collected from individuals in quarantine facilities and from those in the surveillance program. Out of these, 23 tested positive for COVID-19 disease. 22 of them are Kenyans and one is a Burundi national. The cumulative number of those who have tested positive in the country now stands at 672. The overall number of samples that have been tested in the country to date is 32,097.